Great. So we're here at the Dr. Longevity Studio, and I have the great Dr. Jonathann Kuo. Welcome.
Pleasure, such a pleasure. I'm very, very honored to be here, and thanks for showing me around Milan today.
It's been beautiful. It's been beautiful. We've had some nice pasta vongole, a good tour in the Duomo. So yeah, I would love to get into, discussing more about longevity medicine, where it's going, how the US is advancing, because of course, you guys over there are probably 20 years ahead of the game compared to Europe. And I would say maybe to just give some context, you have an amazing, successful studio now, a clinic called Extension Health. Yeah. And maybe you can give us some, idea of how you got there. What was your journey?
Sure.
Would love to learn.
Of course.
And teach people.
Of course. So my journey started 16 years ago at this point. I finished medical school in Boston, and I did my residency in anesthesiology and a fellowship in interventional pain management in New York City, and I set up a private practice right after that. And so I built one of New York City's busiest kind of interventional pain management clinics. And so this is a clinic that's takes insurance. We see everyone from little old grannies with bad knees to the workers' comp to the people that got hit by cars, people in chronic pain. And so we're there to fix pain. And so we're doing a lot of interventional work to do that. So throughout that experience, we've treated over 50,000 patients in these subsequent 15 years at this point. I was very, very busy interventionalist for many years. Yeah. Doing 30 cases a day by myself, just lining up patients in 4 ORs, just going back to back to back to back. Right. But through that experience, I really kind of wanted to go deeper and how can we really help our patients more? All right. So you really kind of peel back the layers of the onion. You really want to get back into the fundamental root causes of what is causing some of these chronic conditions. And that kind of led me into the field of regenerative medicine, using, PRP, stem cells. We were the first ones in the US to really, use exosomes for pain, injecting them into the epidural space. We kind of wrote a few papers on that quite a few years ago. And that also, was the birth of, this whole longevity center that we now have at Extension Health. Along the way, I also pivoted and also did a startup in mental health. All right. So I created a little interventional mental health division of our practice, and that's it's called Hudson Minds. Hudson Medical is the interventional pain part. These practices still do exist, and I have kind of a team of doctors running those. Amazing. But Hudson Minds is interventional mental health. But when you deal with chronic pain, all these patients have anxiety. Coexisting depression and anxiety are super prevalent, 40-50% of these people. So when you treat their anxiety, depression, you can also treat their pain, right? And so what are the kind of very more effective ways to treat mental health than SSRIs and all these meds that just they honestly don't really work that well, right? And so
side effects.
Exactly. So what was that? It was a combination of ketamine, transcranial magnetic stimulation, and these nervous system resets and reboots that I do. Okay, to simplify that, it would be called a stellate ganglion block. Stellate ganglion blocks. But now we actually, we've had a lot of experience modifying these stellate ganglion blocks to make them work better, work longer. Right. And now do this thing called a neuro reset. All right, the neuro reset is a combination of a stellate ganglion block plus a vagus nerve injection, a vagus nerve hydrodissection here, and so. The concept behind that, resetting the sympathetic nervous system and also trying to improve the parasympathetic nervous system. How does that relate to mental health? It's very effective in people that have PTSD and anxiety. Okay. Right. It's just very good clinical data that's very good for PTSD and anxiety. It just shuts off and resets that whole sympathetic overactivation pathway when you block and reset the stellate ganglion, the fight or flight response.
So that's incredibly interesting, and so many people now with these kind of symptoms, anxiety, and so on. And I wanted to just address that. I think the basics of longevity, in my opinion, comes from the pyramid of health that I kind of devised and came up with. And essentially, it's making sure that the lifestyle medicine is covered. So you have what I my acronym is MEDS, so mental health, exercise, diet, and sleep. And I believe mental health of those four is the least studied, the least measured, the least, known. And people out there don't know where to go. So, it's interesting you said ketamine therapy, because if we do ketamine therapy here in Italy, I would be in jail within one day, and it would be a disaster all over the news. But I mean, working 6 years in the US, I worked with specialists, with yourself and so on, with these ketamine, therapy sessions. So I would love to know more about how do these work? What does it involve, and is it safe? I know it is safe, but people out there don't know.
So as my background, as an anesthesiologist and a chronic pain specialist, been practicing for, over 15 years, I have a lot of experience with ketamine. We've been doing ketamine for 10 plus years. All right. As an anesthesiologist, obviously, it's used in the operating rooms for sedation. It's a very useful anesthetic in those cases.
Even in kids for ambulance.
Yes, in kids and adults, just, it's a very hemodynamically stable anesthetic, right? You just don't really have a lot of, changes in blood pressure, heart rate. So it's very safe during anesthesia. Yeah. But also for chronic pain, very useful in chronic pain. We used to do, you can do high dose IV ketamine infusions for chronic pain. And so we did those for, I have a lot of experience doing that. Ketamine can actually be even used topically, in creams or patches for pain. In this setting of mental health, can be very helpful for anxiety, and even for PTSD. And for some other conditions, and it's more specifically depression. IV ketamine is one of the most useful rapid response treatments for depression. Over 80% of people have a rapid response to IV ketamine for depression. So really kind of banning it or making it an illegal substance is really a tragedy, because it's such a useful molecule.
The stigma behind it is...
It's just, there's a lot of stigma behind it. It really should be legalized and controlled. I do want to say ketamine, as with any kind of substance, definitely has its risks associated with it. Right? It definitely can still be addicting. We've seen many people, you can definitely get addicted to ketamine, but used in used with guidance in a clinical and safe way, it is a very, very useful medicine.
Totally.
So I do have to really make that point
across.
So
if I came to your clinic and I was, interested in getting some therapy done, including ketamine, how would that work? Can you guide me through step by step? If I wanted to do a ketamine therapy and explore more.
Here in the U.S., ketamine is legal. It's a controlled substance. It just needs to be dispensed by a physician, right? And so, you undergo a medical intake, and then whether you're using it for depression, anxiety, or chronic pain, you have an evaluation. We take your baseline scores. We make sure you're a candidate for it, and we're very responsible in delivering the ketamine, whether that's in person in an office during a IV ketamine session, which can be very profound experiences, very profound kind of, almost like a psychedelic out of body, deep, almost spiritual kind of deep inwards journey, where you can really learn a lot about yourself and your subconscious. It is a very powerful experience.
It is. When I did it myself,
and therapeutic experience.
It was incredible. Incredible how you can actually see yourself from the outside and start to analyze yourself and see who you are from a different perspective.
Totally.
And I guess, you have specialists just guiding you through the therapy as you get, infused.
During the actual infusion, we do not actually have a therapist there. The integration after these sessions is very, very important, because things will come up during these sessions. As you mentioned correctly, you are in a dissociated state. You're in this third person state. So you're actually able to observe yourself and your thoughts and your patterns from a third person perspective, which can be very powerful if you learn to harness the power of that and be able to integrate what your knowledge and your learnings afterwards. We do have psychiatrists on the staff. We do have a team of therapists that can kind of integrate those sessions for you.
Perfect.
Also, I do want to note that you can also use ketamine in an outpatient fashion, as in the sublingual ketamines these days.
Interesting.
All right. For anxiety, for social anxiety to wind down, I honestly think that is a superior option to alcohol.
Yeah, absolutely.
Straight
what
out
dosages do you typically?
Sublingual, anywhere from 25 to 50 milligrams.
Okay.
Sublingual, okay. If you, it's just so much better for you than just even having 2 glasses of wine or 2 drinks.
I can imagine. Yeah.
Okay. And so there's
studies are there.
Studies there. It's just irrefutable that ketamine, it's just on the risk, on the harm side of things, is just much fewer issues with ketamine. Yeah.
So let's move on to, we were talking about this new term, interventional longevity docs. I think this is incredible because the root of medicine, I think regenerative medicine is what we really need to be looking at, because it really uses the power of, stem cells, regenerative tissues and so on to absolutely reprogram ourselves and reprogram our bodies, detoxify our bodies, decrease inflammation and so on. So you are one of the godfathers, I would say, of the longevity doctors in terms of interventional longevity doctors. So how are you applying this interventional approach in medicine and longevity medicine today?
Sure. As I gave you my background, I'm an interventionalist. I love actually, trying to figure out what treatments can be the most beneficial for people. I started off using, injections of, traditional things like steroid and local anesthetic and burning nerves and stuff like that, that kind of obviously, evolved into regenerative medicine where you're harnessing your own body's natural ability to heal. That kind of leads into peptides, a whole nother segment, right? Peptides are short chains of amino acids that mimic certain proteins and molecules and hormones that our body naturally produces. So what peptides do is they augment and improve upon your body's natural physiological processes, whether that be in metabolism, improving reducing inflammation, improving healing, improving collagen, improving growth hormone, stimulating more muscle, the list goes
and
on
these
and on.
peptides decrease as we age because we can't produce them, right?
Correct.
Anymore.
So as we age, we decrease our production of peptides and hormones, and so you do need to replace both peptides and hormones. On the interventional front, there's a whole bunch of other things that we do these days. I did mention the neuro reset, which is an actual physical reset of the autonomic and parasympathetic autonomic nervous system. Then we also do what I call blood therapeutics. Okay? Blood therapeutics such as plasmapheresis or therapeutic plasma exchange. This is where we remove around 2+ liters of your plasma.
And you put 2 big needles, right?
Yeah, it's 2 IVs, two large IVs.
One on each arm.
Yeah. Process takes around 2 hours, 2.5 hours. We take your blood out of circulation. We pass it through a machine. We save your cells, but then we discard that layer. We discard the plasma, right? And so as we age,
you replace with albumin?
We replace that plasma with albumin.
Okay.
And albumin and saline, right? And then there's also a whole bunch of other kind of replacement solutions that we're looking into. Okay. There are options. We can get into that later.
You could put exosomes, stem cells, you think?
Correct.
That could be a game changer, right?
Correct. Afterwards, would you do some NAD or Niagen? Would you do some methylene blue? Would you do some stem cells and exosomes? Usually straight after. A lot of times we do kind of give it a period of time to wait after plasmapheresis just for the hemodynamic shifts, just to rebalance a little bit before we kind of add anything else. But you can combine some blood therapeutics together with, say, EBO or EBOO, right? So that's ozone dialysis. A similar concept in, extracorporeal circulation of your blood. We're taking the blood outside your circulation, passing it through a machine, a filter, applying ozone, applying oxygen, and then running your blood through lights.
Right. So, because in Italy, we use ozone therapy. That's what we do.
Correct.
And we take the blood out of your body into these tubes, into these bottles, and we ozonate that blood and we reinfuse it straight after. But these EBO machines are actually newer, right? Different.
Yeah, the EBO machine's been around for a little while now, but you just get much more blood surface area contact with ozone with these machines because you're actually, you're in the filter. You're exposing a large surface area to ozone. And so it's the amount of ozone that you can actually expose your blood to that actually makes that difference.
Yeah.
Right? And so
it basically, so the ozone blood re-enters your body, it actually causes a oxidative stress, right?
Correct.
And it's a hormetic 15 minutes of hormetic stress.
Correct.
That will give you that benefit, right? So that's why you have to do it how many times? Probably.
I mean, typically, it's the different protocols for different conditions. I mean, if you're sick, you should probably do 3 to 6 sessions of ozone. Once again, it's a very potent stimulation of your immune system. Yeah, it really kicks your immune system in the ass to like function better. Right? It just overall over time it reduces inflammation, but the initial actual action is as you said, an oxidative stress response. All right. To test your antioxidative capacities of your system. Right. So to test that, but one of the also things is ozone is a disinfectant. All right. True. Just like the viruses, the bacteria, the mold, the fungi, like that stuff gets inactivated, killed, deactivated. And then also just, we run it through lights. That actually gives power to the mitochondria. So there's a whole bunch of great things that ozone does. Ozone's not even really used that much in the U.S., but
in Italy,
a very powerful modality. Yeah.
Yeah, it's huge. Yeah. So, I mean, I've been learning from you quite a lot about peptides and peptide stacking because, I mean, not only you're amazing at, bringing the best peptides together and stacking the right types of peptides and mixing them together, but your protocols are extremely innovative. So tell me more about your peptide stacking. I mean, I would love to learn which ones have the most efficacy and you've seen have the best results with your patients.
Yeah, I mean, peptides, broad topic, okay? But, to simplify them down, you break them up into categories. You have the metabolic ones, all right? Metabolic, let's just call them the GLPs, all right? Let's just call the GLPs. So you have the semaglutide, tirzepatide, and third-generation retatrutide. I'm a big GLP fan, all right? I'm a maximalist on GLPs. Like, the studies are out there, all right? They help with everything, all right? Cardiovascular, neurovascular, diabetes, metabolic, like everything. Because you know what, it just decreases inflammation, and in the long run, you want to simplify it all down. It just lowers the amount of inflammation that you're having in your system. That benefits all the systems. It prevents all the 4 kind of horsemen of chronic disease, right? And so
in all patients as well. Like there's not
all patients.
I've seen it in all patients. It's incredible.
So I've been out there. I've been speaking. I believe that almost every single human should have a relationship with a GLP-1.
True.
All right?
I agree.
A relationship. Microdosing your GLPs is a brilliant option to get your metabolism just working that a little bit better. All right.
Microdose, we mean. 2.5 tirzepatide once every 2 weeks. What would you define as a microdose?
Everyone has a little bit different. Like I like to push the microdose limit to a point where someone feels a little, and the people that are not trying to lose weight, like myself, I'm not trying to lose weight. Right. I push it to where I do feel a little bit of satiety, a change in satiety. Okay. Almost everyone would benefit from eating a little less. Okay, almost everyone. Unless you're a cachectic, you're undernourished. Like almost everyone benefits from eating just a little bit less. Yeah, it just also shifts your satiety center, so you just make better food options, right? And just having just better diet is a cornerstone of everything.
Make sure you keep your proteins high. Make sure you exercise. Yeah, because maybe let's debunk some GLP-1 myths. I would say. One of the biggest ones I get from my patients is, GLP-1s cause muscle loss. Yeah. Now, we know that it doesn't directly cause it. What's your take on that?
Yeah, it doesn't directly cause muscle loss. Like there are many ways to kind of try to spare any kind of muscle loss. Right. You take your creatine at relatively high doses, 10, 15 grams a day. You take your protein intake, and you should be doing at least a gram a kilo. Like in the U.S., we're pushing this to like 1.5 to 2 grams a kilo even. Don't take too much, okay? Too much protein is also not good for you. There's like a limit of what you should be taking. Right. And then resistance training. Everyone needs to be doing resistance training. If you can do all these things, then you're not going to lose muscle. Right.
Yeah. Oh, that's so true.
Yeah.
Which one's another big myth on the GLP-1 side that you hear patients say a lot?
This whole, cancer, thyroid cancer, right? Like, that's only been shown in rats. Thyroid medullary cancer. It's already a super rare kind of thing. Like, I've never seen that clinically as being a thing. And you got to weigh the risks and benefits of everything, right? Like, the multitude of benefits on the metabolic side far outweigh the risks of possible cancer.
I agreed 100%.
Yeah.
And so, keeping the topic on the peptides, you said what are other interesting stacks? That you feel
they're the basic ones. Okay, so we went over the metabolic category.
Yeah.
Let me just list the categories first. All right.
Let's do that.
There's a metabolic category. Then there's the repair and inflammation category, where you have the BPC 157, the TB 500 or TB 4. You have the GHKCU, right? And then you have the growth hormone stimulating category, boosting your natural growth hormone levels, growth hormone releasing GHRH, growth hormone receptor releasing peptides to stimulate you to release a little more growth hormone.
And that helps muscle building, helps with, repair.
Muscle building, repair.
Who should be taking it and how?
Great question. That is a great question. That's, a lot of people benefit from taking growth hormone peptides.
Right.
Okay? This is, however, something that should be done under supervision with a physician, all right? Because you do need to make sure that you do not have cancer, that you check your blood work, that you monitor your renal, your kidney functions, your IGF-1. These are things that do need to be monitored when you are on a growth hormone peptide, all right? Yeah. Most of the times they are very safe. These also do need to be cycled. You do need to use the dosing appropriately for these. So growth hormone peptides, very effective, all right? But you do need monitoring, and you should do them the right way.
And for example, I'm 32 years of age now. Yeah. Would it be something I could take?
Totally.
Absolutely.
Totally.
Right?
Absolutely. Yeah. Absolutely. Once you pass your physiological peak of growth hormone secretion, which is usually around 25 to 30, the level kind of drops. All right. Like, to boost your own kind of growth hormone levels just a little bit, makes sense. All right. It just makes sense. Good for muscle mass, great for sleep, good for energy, good for cognition. There's just so many benefits of having adequate growth hormone.
And you mentioned cycling. You do 3 months on, 1 month off?
3 months on, 1 month off, 2 months on, 2 months off. Like, there's multiple different protocols that you can do. You can switch and rotate between them. You can do a CJC IPA for a month, TESA for a month, off. And then you can repeat that cycle. There's many different ways to do that, kind of depending on your goals.
Right.
Yeah.
And another question is, a lot of patients, let's say late 30s, early 40s, even into the 50s and so on, perimenopause, menopause, they're all complaining of, low libido.
Yeah.
So how do we help these women, help these men with the libido, if it's with peptides first and maybe hormones? What would you say is the best?
I would say the first thing for sure is you got to fix the hormones.
Yeah.
All right. Like, you got to fix the hormones. Men, almost, and we see so much low T these days. You know that. So we're
testosterone is
plummeting.
And even after your 30s, right?
After
testicles
30s,
stop producing. We have toxin, microplastics.
It's a recent modern day phenomenon, because just even 20, 30 years ago, it wasn't this bad. All right, but
T in men and T in women, right?
Both, yes, absolutely. Women need testosterone, right? Women do well with testosterone. Women's libido improves significantly with testosterone. And so, on the peptide side, there's also many different ways that you can either try to boost your T levels, such as, it's not a straight peptide. We use a lot of HCG, human chorionic gonadotropin, right? Yeah. Doing that naturally stimulates you to produce more testosterone by just mimicking LH or FSH.
And that's a peptide injection.
Yeah, that's just a sub-Q injection. Yeah.
Every how often?
Depends on how you want to do it.
Right.
Usually it's 2 to 3 times a week. Usually 3 times a week, around 500 units 3 times a week is where we start most men. Then you kind of monitor those levels and kind of see where that goes.
And should these people be on it forever, or is it something we can also cycle?
Need a cycle. You need to cycle that.
Agreed.
You need to cycle that. Yeah. Also a few months on, few months off, 1 month on, 1 month off. There's many different ways to do HCG. You should be monitored, right? You should get those T levels checked, see where you're at.
Yeah.
Yeah.
And peptides for sexual arousal.
Mm-hmm.
I remember we had this discussion once. You mentioned oxytocin.
Yeah. PT-141.
PT-141, nasal spray.
Yeah.
These are both excellent options, right?
Excellent options. PT-141 is really great, right? It can improve central arousal mechanisms. It's not just a vasodilator. I've seen great results in both men and women. The injectable version works the best, but a nasal spray version works too.
And you want to
poke yourself,
just before,
I would say an hour before, but in some people, I mean, it takes like 6 hours to kind of be most effective, but then it lasts for quite a while too. So the injectable version can be quite powerful, but you also just need to dose that correctly, because a little too much, you'll get very nauseous.
Right.
Yeah.
Right. Absolutely. Yeah. Awesome.
Yeah. PT-141 and oxytocin, and then combine that with a little vasodilator like tadalafil, and those are available. You can do those as a sublingual drop.
Yeah.
Okay. You can do that PT-141 oxytocin as a nasal spray. So many different options these days, but
Amazing.
Great stuff. Really great stuff.
Awesome.
Yeah.
So let's close on the therapeutic side. What would you think is the upcoming most interesting therapeutic, intervention now that people should actually look into? Go to Extension Health maybe, and and get some more information about, or even doctors nowadays that might not know.
Yeah, of course. Exciting things definitely in the blood therapeutics region. All right, we use plasmapheresis. We have a good amount of experience with that. Next things that are coming abroad on the horizon is, ionospheresis. Ionospheresis is actually widely available in Europe, but coming to the States, we're going to be one of the first clinics to have that. Double filtration system, very different mechanism than plasmapheresis. Each has their own kind of benefits and downsides. I don't think they are mutually exclusive, right? There's also this marker column these days. The marker column is an absorbent column. It uses absorption rather than actual filtration or discarding. And so there's going to be kind of their benefits of the absorption column as well. Speaking to the people that, that make that, I think the preliminary data for that's kind of very interesting as well.
Blood therapeutics.
Yeah, so blood therapeutics, whether it be,
Awesome.
discarding as in plasma, double filtration versus a column, whether it's a combination of those things. I love to combine therapeutics, like really thinking about the physiology of how each one of these mechanisms work. There's going to be some kind of combinations that work better for people that are trying to either fix disease versus optimize. Right. And so that's on the blood therapeutic side. A lot of very interesting stuff on the gene therapy side.
Oh, I love that topic. Yeah, very new.
Very new, but it's, also, at this point, the various, there's two main kinds of gene therapy. Either you're using a virus vector, an AAV vector, the adenovirus vector, for various gene therapies, or you're using the plasmid technology. All right, so the plasmid technology is available now. It's by Minicircle. It's follistatin gene therapy. And so we've had, we've had quite a lot of experience with follistatin gene therapy at this point.
And what does it? So let's explain to the audience. Okay, gene therapy with follistatin.
Yeah.
Okay.
Let's go back to
muscle growth. Yeah. Like how does it work, and how does someone approach it?
So follistatin gene therapy is it's a plasmid gene therapy technique. All right, where you have a circular strand of DNA, a plasmid of DNA, that it's delivered via subcutaneous injection, and so it's supposed to last around a year, sometimes 16 to 18 months, sometimes even a little longer than that. But the plasmid of DNA is encoded with instructions to produce follistatin. Follistatin is a peptide. Peptide is something that influences a biological function. In this case, follistatin, long story short, is it helps you build more muscle mass. All right, and so you can do peptide injections of follistatin as an injection, but follistatin has a very, very short half-life. All right, and so you're not going to inject yourself 10 times a day, right? So the gene therapy is basically, it goes into the cytoplasm, or it does not incorporate into your own DNA. Okay, it stays in the cell body, the cytoplasm, and it continuously
Like
produces follistatin.
Machine producing follistatin.
Yeah, it's like continuous peptide therapy is what you can think of follistatin
Amazing.
as. Yeah.
And this just, keeps generating into all the cells and generates follistatin. So it's essentially like a peptide like factory, right?
Yeah, a little peptide
Amazing.
factory, but it's localized.
Right.
If you're injecting it, into the arm here, you have a localized factory of follistatin just being generated by your muscle and the surrounding tissues.
And does it go systemically or mostly stays?
I think it should be mostly a local effect.
Yeah.
Okay? Yeah. I mean, when you go into the AAV gene therapy, those are also done as subcutaneous injections. But the way I've seen those being done is you get like literally you're getting a lot of different muscle areas injected to have many different foci of peptide machines throughout your body.
Very nice.
So, yeah.
So let's maybe touch on to the newer diagnostic part. So I think in the diagnostic field, we've been doing all kinds of, measurements from blood measurements, blood labs, imaging, CCTAs to detect, heart disease and so on. But now we've started going more deep into the cell and looking at, mitochondria, you were saying.
Yeah.
So tell us more about this new trend and this new, wave of diagnostics into our, energy factories, right?
Yeah. I mean, I think, medicine is, we what I practice is cellular medicine, okay? And when you really think about, when you dive way back into all the root causes, the fundamental root of everything is the actual health of an actual individual cell, okay? And so what constitutes a healthy cell?
Yeah.
It really is the mitochondria, all right? The mitochondria that are producing energy in your cells, all right? So this has kind of been very overlooked in kind of traditional medicine for a very long time now, but a lot of disease actually roots in dysfunction of your mitochondria. Yeah. And so,
this
they're
is
really
the powerhouse of our cells, right?
Exactly.
They produce the ATP.
They produce all the energy.
They do all kinds of functions, and,
so
metabolically.
Exactly. So, it's only till very recently have you been able to actually look at the function of your mitochondria. And so I think this is going to be a big topic coming up, all right? Is like everyone should really understand how well your mitochondria work. Right. And so there hasn't been great testing until, more recently these days. There are a bunch of companies out there doing this testing now.
This is a blood test?
This is a blood test.
Right.
This is a blood test. You used to have to do a muscle biopsy, right? And so how many people are going to do that, versus now you can actually do a blood test. Now you can actually just drop your blood on a dry blood card. There's a company that does it called MeScreen. That's something that we're going to incorporate here at Extension Health. It's just you send that in. They can just give you how your mitochondria are functioning, all right? It's a reliable test. It's reproducible. And then you can actually see what you need to do to actually improve mitochondrial function, all right? Because there's so many different pathways in which the mitochondria work, and then there's so many different ways that can go wrong, and so you actually have to know which pathways to actually fix, right? And
so now we have Now we have a diagnostic test for mitochondria. You're saying this is going to be the future because we're actually really looking at the real powerhouse of your cell. And so now that we know that my mitochondria are healthy, non-healthy, inflamed, decreased, and so on, what can we do? Like, what are the main interventions? Peptides.
So, on the more basic end, it's a lot of things that you hear about these days, as in the saunas, the cold plunges, the cryos, like the red light therapy, the PEMF. There's so many things that, obviously, of course, exercise, like those are the main things. I mean, the best thing is exercise. Okay. It's better than any drug, peptide, anything. All right. Exercise is the best.
Number one.
All right.
Get that straight.
Yeah. And get that straight. But, going further than that, there's so many different mitochondrial enhancing things that we can do these days. Everyone by these days has heard of NAD, right? All the various NAD, whether it's injections, supplements, precursors, NMN, and Niagen. There's that's a whole topic by itself, right? Then there's we actually really like using mitochondrial peptides, all right? So the mitochondrial peptides fantastic. All right, one of my favorites. All right, either as of right now we have MOTS-C. We have MOTS-C. We have SS31.
Yeah.
We have Humanin or Humanin. And then we have like CD4211, and there's like a whole bunch of other smaller kind of different random ones that are kind of coming out under investigation. Have had great success with MOTS-C and SS31. I think almost anyone can be on MOTS-C and SS31. MOTS-C is more of a performance enhancer.
And that's daily injections of Q?
You can do it daily. I mean, a lot of people do it a few times a week. I recommend MOTS-C before exercise. All right, it kind of greatly improves your kind of exercise ability and tolerance and stuff like that. SS31 is more of a repair mitochondrial thing. All right. Yeah. I've seen it very, very helpful in kidney dysfunction, chronic kidney disease. It can be very useful for cardiovascular stuff. And there's honestly just like very limited side effects with SS31, even in very high doses. All right. So I use SS31 to prep people for surgery, to actually help people recover from surgery. And almost a lot of chronic disease do respond well to a combination of SS31 and a lot of the other kind of other peptides that are out
awesome.
there. Yeah, I love the mitochondrial ones.
Yeah, huge topic. I think we should really look into. So, just a quick note. Let's spend maybe like 1 to 2 minutes in the interest of time, and let's try to debunk the NAD IV kind of trend and. I mean, I love NAD, but there's people that use it every, week, every day. Some supplements, some, do it IV. Yeah. What do you think is like something we need to know about NAD that?
I mean, there's no kind of like, there's no right amount of NAD to take, okay? Yeah. Unfortunately, we just don't know that yet, all right? Mm-hmm. Do the precursors improve the amount of NAD available in the system? Yes. Have I ever really heard of anyone being like, I take NMN and all of a sudden I feel amazing? Not really, okay? No one is like, oh, wow, this like really, really helps my energy levels, okay? In sick people, IV NAD infusions can be very helpful.
Absolutely.
Very helpful. Yeah. In long COVID and people are very debilitated. Dependencies. It can be helpful for dependency, alcohol dependency, a whole bunch of stuff. IV NAD can be very effective. These days we use IV Niagen, which is a precursor, much easier to infuse, much less discomfort when you do that. I've been liking NAD as IV Niagen, I kind of use it along with some of my regenerative medicine therapies. After you do a regenerative medicine procedure, you get stem cells, getting some Niagen or NAD, I think is very helpful. Yeah.
But to that point, is like these are focused protocols for specific use cases and specific patient cases.
Correct. Right? As in, you can do, if you take too much NAD, you can overfill your bucket. You can overfill your bucket, and that's going to overflow into some of the other pathways, and you can get actually additive oxidative
inflammation.
Correct.
Cardiac issues. Yeah. It's like a load of
If you're really trying to improve your NAD levels, I actually think of it as like you look at the pathways. Okay, there's a CD38 pathway. There's an NNMT pathway, and so you can use a combination of things. Okay, one of the things I really like a lot these days, but a lot of people don't know, is 1-MNA. All right, 1-MNA
comes out of Poland, actually.
Yeah.
Europe.
So, you can use 1-NMA in combination with NMN or niacin or something like that, okay? And then on the CD38 pathway, you can use something called epigenin, all right? And so if you're really trying to boost NAD by using orals, I would take 1-MNA, NMN, and epigenin together. Right?
Stacked.
Yeah. You can stack that. And then occasionally get your, Niagen infusion or something like that.
And do like a 3-month cycle.
Yeah, I mean, NAD technically doesn't need to be cycled, but I still I don't love putting someone on something forever and ever.
Right. Absolutely.
Other than GLPs. Okay.
Exactly. Great.
GLPs, yeah.
So maybe let's shift focus. A really hot and trending topic, of course, hot and trending topic today is AI and AI in medicine, right?
Yeah.
So, I mean, in my practice, I've been using AI extensively. I anonymize my data, but I use, all kinds of LLMs to interpret my, data, interpret labs, interpret kind of the whole functional aspect of a patient's treatment protocol.
Yeah.
So, I mean, in the U.S., it's bigger than ever. Are you utilizing it now in your practice?
Yeah.
How are you utilizing it?
I mean, every day,
Every day,
almost
right?
every day, almost every patient interaction these days. I mean, you kind of have to be a AI assisted physician these days to do your best job. Okay,
No
it's
question
like
about
your
it.
responsibility to do that. And guess what? AI is like attaching another brain that on top of yourself. You still need to do the thinking. You can't just have only AI do the thinking. Okay, but over a period of time, like our entire practice shares a team account. All right, and so all the knowledge is uploaded. Everything, all the documents, SOPs, all the protocols that we create is uploaded into this
LLM AI system,
right?
Yeah.
And so like our staff from the most junior to the most senior will query, ask questions of this system and get appropriate answers that we can basically. So it's basically like democratizing knowledge within our organization.
Absolutely. And if you're not using it in your practice, you're way behind.
You're way behind.
I would call ourselves super longevity doctors if with the power of AI, and it's helping in all cases. And I think what I see as the future here is these. The accumulation of data and the amount of data that we get from a human being is incredible, and my mission so far has been to digitalize humans.
Yeah.
Once we have these digital twins, digital representations of humans, we can then easily feed AI models to give us the best interpretation.
Correct.
And this is kind of bringing in the new field of augmented generative health.
Right.
So
That's right.
AI is predicting what's gonna happen to you, getting all these parameters, creating these like phenotypic models, and then essentially predicting what kind of outcomes you're gonna have, and then personalizing your therapeutics.
Yeah,
and
absolutely.
it's huge.
Absolutely.
And I'm seeing EMRs, so electronic health systems that support clinics, integrate AI now, and I think that's probably the only way doctors can easily probably integrate AI within their practice. And we're both actively doing it, right?
Yeah.
So
we're actively transitioning our systems into full AI systems.
Yeah.
Like, unfortunately, the old EMRs,
it's like
they were not built. They were not built for the massive amount of data input these days from wearables, blood work, disparate data sources. No matter how many APIs you have, like uploading PDFs, like that's just not a possibility to kind of aggregate and look at that data as an entirety.
Absolutely.
So,
true.
We're working on that.
It's a great field. Wearables, which wearables do you like the most? Have you seen your patients use the most?
I mean, Aura Whoop, right here in the U.S.
I'm a big Aura
Whoop
fan.
Our memberships, we take a look at both of these data. We feed that data into our algorithms.
This is continuous 24/7 data. I mean,
correct.
It's connecting our practice to a 24/7, measurement sensor. Correct. I love CGMs. CGMs are
great. Yeah,
great way to see your glucose spike.
Absolutely.
You put it on your arm, the back of your arm, and it just measures your glucose 24/7. Yeah. Tells you if you can eat or not eat some certain food.
CGMs, eventually they're going to monitor way more than just glucose, right? And they can measure everything. Your electrolyte balance, your hormones,
right?
Can you imagine having a continuous testosterone monitor?
Oh, that's going to be the next thing, right?
Yeah, or
continuous hormone monitors. Yeah. I mean, we can actually track everything morning, night. That's awesome. Yeah. And so, I mean, I love what you're doing with your practice. Maybe we can finish and give people an idea of where longevity medicine is going, in your opinion. And
I mean, we're in a great field. We're able to help people. We're able to use the latest technology and science combined to really move the field of medicine, and we're seeing results. At the end of the day, it's just all about results, right? Like, are our patients getting better? Yes, they are. I practice traditional medicine, and I know what those limitations are. With this, it's just a whole wide world of possibilities for actual disease reversal and prevention exist. And so, this is going to be every every doctor should be a longevity doctor. Every doctor should know about all these things. Every doctor should know about peptides. Peptides should be legal in every single country. Like, you know, you're going to just improve population health by so much if you just open up your ideas to peptides, stem cells, regenerative medicine, ketamine, psychedelics. All these things make a massive difference.
So all preventative therapies, everything to optimize and, you know, prevent the disease from happening, which is what we actually do.
Correct.
Okay, so last question. What are the 4 supplements you think everyone should be on? I have a list. I think magnesium, vitamin D, creatine, and you know, we can mix the last one with many. But
okay, mine are it's actually a GLP.
GLP.
Yeah, a GLP.
I love that.
A GLP, vitamin D, creatine, and some kind of mitochondrial booster. Okay.
Amazing.
Mitochondrial booster, whether you want to do the peptide route, whether you want to do ketones, whether you want to do some of the kind of performance enhancing ones, like everyone could benefit from slightly better mitochondria.
Amazing. Yeah. Okay, so I mean, we've been talking about incredible interventional, you know, therapeutics, diagnostics, and so on, but for the average listener, someone that cannot maybe afford these, you know, bigger interventional therapies, where can someone start? Where can someone start and embark this longevity journey?
Yeah, I mean, you know, first it's just learning, okay? It's education, just knowing that all these things exist, like just, you know, being able to speak intelligently about them, making sure you actually know your biomarkers is very important. Like, you know, men and women you should know your hormone levels, okay? You should know, you know, your metabolic function. You should know how much inflammation you have.
Blood
the 3
panel.
basics, right? Get your bloods checked, making sure that, you know, you're just interested in your own health. That's step number 1, because a lot of people are actually just don't really care that much. And like, you know, if there's anything in life, you have to be proactive. You have to really, really care about yourself as the number 1 priority in your life.
Totally true.
Can't really
invest in your health.
Exactly.
This is the most
best ROI you can possibly get.
I always say, you know, medicine is broken. We have medicine which is reactive, and we want to be proactive. We don't want to wait for the symptom to arrive, and it's too late to, you know, treat and so on.
Absolutely. Yeah. And then, you know, the next steps, I would say, start with some of the basics. Okay. What are some basic longevity interventions that you can do? You know, absolutely, you know, we just go back on this just one last time. The diet, the sleep, and the exercise, there are ways to optimize that. Even if you think you're doing well, you can do better.
Always.
You can do better. And those interventions are free, and they're going to do more for you than taking any of these, you know, newer, higher end therapeutics and peptides and all that stuff.
And be consistent. And every day, just try, even if it's 2 kilometers of a run.
Yeah. So diet, sleep, exercise will get you 80% of the way there.
Agreed.
Okay. The last 20%, so you can make big improvements, unlocks with, you know, these therapeutics I talked about. You know, but that's kind of like the cherry on top. And yes, some of this stuff can get expensive, but you know, GLP-1s are widely available now. All right. So like look into that. There are other things, like very simple things like metformin or low dose naltrexone or rapamycin. There's like some of these like longevity medications that are kind of a little more on the basic side that I still think work. Okay. And so I have most of my patients on the little combination of that. You know, the longevity starter pack to me is like a low dose GLP-1, a little rapamycin, a little low dose naltrexone. All right. That's like kind of my like little trio that almost everyone can be on. Yeah.
Low dose naltrexone, so 4.5 milligrams.
Sometimes even lower. Sometimes even lower. 1 to 2 to 4. Right. You know, those are kind of the little titrations.
How about your metformin?
Metformin is like 500, maybe once or twice a day. You know, with the advent of GLP-1s, I'm using metformin a lot less these days. Exactly. It's a little dirtier than a GLP-1. Kind of does kind of like doing relatively the same things. So I'm kind of liking the GLP-1s a little more than metformin these days. Amazing. A little off topic there. But, you know, one of the last things I'll talk about is like, you know, I mentioned a lot of these therapeutics, the longevity therapeutics. It's not going to be one thing or one medicine or one gene therapy that's going to like make all the difference. All right. Like it's going to be a combination, a thoughtful combination of all these various therapeutics together. And so, you know, that's what, you know, I think I've spent a lot of time thinking about how to stack these therapeutics in ways that make sense physiologically. All right. And so, as an anesthesiologist, I love just physiology, and you think down to the basics again. What makes the cells healthiest? Blood flow and oxygen. So how do you promote as much blood flow and oxygen to your tissues as possible? So, things like when you do a blood cleaning, after the blood cleaning, sometimes you would do a shot, one of these neuroresets to do a little vasodilation to send more blood flow to the brain before you do a hyperbaric session or before you do, stem cells or exosomes.
Absolutely.
Just to get more blood flow there. And then you go to the hyperbaric and you kind of bake everything in with pressure and oxygen, right? And so, also doing blocks, these vasodilation, just, you dilate your blood vessels so you get more intravascular blood volume. And when you do that before a blood therapeutic, you're just going to get better results, right? Because there's just more blood in the circulation. And so you got to think about the physiology of various systems and how they stack together to get the most optimal results.
Stacking. Absolutely true. So where can someone find you?
Online. Follow me on Instagram, just Dr. Quo, and at Extension Health. Our website is extension.health, and I try to democratize knowledge. I love kind of sharing what I know with everyone. That's kind of one of my missions in life.
I love that.
Is to kind of teach people, teach doctors, teach as many people that these therapeutics exist.
Perfect. Thank you so much.
Thank you so much. Such a pleasure.
My pleasure.